So what we've been seeing is that since 2015, there has been about a 30% rise in the diagnosis of STIs, including gonorrhea, chlamydia, and syphilis. And so the CDC has guidelines that consider that rise in diagnosis of STIs. And so what they do recommend is that opt-out testing can be considered for both chlamydia and gonorrhea. So what does opt-out screening mean? Opt-out screening is different from offering screening. Opt-out presents screening as the norm, and you can choose not to have screening. So if you're placed with a test and you are presented as the norm, it sometimes or potentially can reduce the stigma of you associated with you getting that test, because everybody's getting that test and it's normal. I'd like to use another example. For example, in pregnancy, HIV testing is opt-out. Every pregnant woman has HIV testing as part of the panel. It's automatic, it's part of the bundle, they're screened. They don't have to think about it, they can choose not to, they can opt out, but it is considered normal. So that is an example of opt-out screening. So for example, if a young woman, say she's 16 and she's sexually active, but she doesn't want to disclose that, and there's opt-out screening, since she only has to say something if she does not want to do the test will be automatically done. Implication of opt-out screening is that is more likely to diagnose chlamydia when it's present, because more people will be screened. It would diagnose it earlier and reduce the potential cost associated with being diagnosed later and the complications that may happen when it's diagnosed late.